Generally, when you go for an initial appointment, you meet the dentist and his team. I think this is a very important meeting just because you are going to get a good feeling of, is this the right office for me? So I really encourage you to arrive early, go and see the office, see how they're treating other patients. Are they put together? Is it a clean office? And so forth. A lot of major complex dentistry has to do about relationship between your dentist and the staff. If, for example, you're having some issues and problem and the dentist is not willing to, or the staff is not very friendly, you may dread going back to that office and so forth. Then the next phase is the discovery phase. The discovery phase is a phase of the treatment where basically most patients skip, or most doctors skip this phase the way they should. It could be because the patient insurance is not covering that, or it could be because of the fact that the dentist is in a rush and he's got 10 other patients waiting in another room while he's seeing you. So we'll talk about that, why that discovery phase is so important. Treatment plan phase based on your goals and budget. Again, dentistry has become so complex that really having a good idea of a realistic budget before you have a treatment plan done with a dentist is something that you need to really look at it realistically and be able to let the dentist know what that budget is. During the discovery phase, the dentist generally does 4 areas. One is a soft tissue, which means, all your gum tissues and the tongue and the muscles and everything else there. That's an important area because a lot of the systemic diseases in the body does show up in the mouth. Then from there on is the periodontal evaluation. That's the foundation of the teeth and holding the teeth in place, okay? We want to make sure that everyone is really periodontally disease-free. The third one, which I have highlighted in yellow here, is the occlusal evaluation. Unfortunately, this is the most skipped evaluation by most dentists. And a lot of the problems we'll talk about tonight, from the failures and different things that happen, even the sleep apnea situations, a lot has to do with the occlusal evaluation. Or the bite evaluation that is a skip. Then obviously is the evaluation of the teeth themselves. The bite evaluation, again, this is the most overlooked evaluation, followed by the periodontal examination. Bite problems really account for one of the highest reasons that fillings, crowns, bridges, dental implants, and natural teeth fail and break, okay? So some of the issues that come up with the bite are fractured teeth. Just 5 o'clock, I was driving over here, my office, Palm Desert, called. An old patient has broken a crown that she had put about 30 years ago. I was talking to her a few weeks ago, the fact that she was having a lot of bite problems and clenching and so forth. Gingival and gum recession. Periodontal disease, you may have really good oral hygiene at home, but you keep seeing your dentist and the dentist tells you, you know what, you have bone loss and we got to do some deep cleaning, we got to do this, we got to do that. A lot of it could be a bite issue, so that's something that really needs to be addressed. Sensitivity in teeth. When people have bite issues, generally shows up as cold or hot sensitivity, and unfortunately, a lot of times, again, because the bite evaluation is overlooked, I see many dentists, they jump into doing root canals for patients, okay? Where really the patient's bite could have been adjusted and evaluated and the root canal may not have been needed. Dental implant failures and a collapsed bite. One of the major problems I see in dentistry is that I always get patients come in and they're complaining that I went to a dentist, he did a bridge, and then I went to another dentist and there was an open margin or a problem with the seal of the margin there. Again, unfortunately, some dentists, they blame each other for doing that. One of the things that we look at in our practice, the first thing is the bite, because if the bite is not right, as you can see on the picture, just the physics of that, it will cause so much pressure on one crown that that bridge can become loose and cause an open margin. So again, bite evaluation is very, very important.